This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday, getting the week kicked off with medical talk on Mon Health Talk, WAJR for this Monday morning. Thanks for joining us. I'm Kyle Wigg, sitting in for Dave, who's got a full morning scheduled. He'll be by with Talk of the Town, then he'll be filling in for Hoppy on Talkline. So you'll hear Dave over the course of the next 3 hours. But the next 20 minutes, we'll talk health with Dr. Chad Micucci and Dr. Matthew Schessler there with Mountain State Orthopedics. And do we have both you gentlemen on the line?
You sure do.
All right. Good morning.
Good morning.
Let's talk about Mountain State Orthopedics, the services that you provide, and your connection, your partnership with the Mont Health system.
Yeah, well, we've been partnership with Mon Health for a few decades now, and we have 6 doc group, fellowship trained in pretty much all aspects of orthopedics, other than spine surgery here, but otherwise practice through Mon Health and provide the orthopedic care in North Central West Virginia. Okay.
Dr. Schessler, let's talk about your specialty and why you chose the Mon Health system.
So I went to WVU for both undergrad and medical school, then went up to Pittsburgh to do residency and did a hand surgery fellowship for a year up in Boston. I wanted to come back to West Virginia. My family's from here. My wife's family is from here. This is a great place to live and raise a family, and so I was very fortunate to be able to get a job with Mountain State Orthopedics and work with the Mon Health system. All
right, Dr. Micucci, same question for you, your specialty and why Mon Health?
Sure. Well, this sounds somewhat similar, and I'm the older one here. So I went to WVU as well, both physical therapy school and medical school. Went up to the Allegheny Health System for residency. My specialty is sports medicine and arthroscopy specialist for knee and shoulder mainly, and basically came back to Morgantown for the same reasons that Dr. Schessler spoke of, and couldn't be happier to be with a great group, well-respected group here in Morgantown area.
All right, I would imagine that both of you and your entire doctor group are dealing with a number of fall injuries this time of year. I would imagine with the ice and the snow, that presents itself several issues. So let's talk about that, the type of injuries that you see with the falls on the ice or perhaps people shoveling snow, that type of thing. Dr. Schessler, let's start with you.
Oh, winter, there's certainly a very characteristic pattern of injuries. Probably the most common one that I see are someone who slips and falls on the ice, puts their hand out to break their fall, and then you break your wrist. That's certainly a common injury. Sometimes those types of breaks, they should certainly be looked at and evaluated. Sometimes they need surgery to fix them. Sometimes they can be treated with a cast. But that's a very common injury this time of year.
And, of course, your specialty there, hand and wrist injuries. So I would imagine you see those that are very, very plentiful. And Dr. Micucci, I guess the same situation with people falling and breaking a shoulder or, again, the lower extremities as well, hyperextending a knee, that type of thing. Is that the type of thing that you see?
Yeah, absolutely. And I think you certainly have some ESP there or something. I was on call this weekend, and we saw a lot of the exact mechanism you just described of falling, slipping on the ice, and a lot of shoulder fractures, fixed a few hips over the weekend as well. We see a lot of hip fractures and ankle fractures during this time as well. And so, again, as Dr. Schessler mentioned, all of these issues certainly need to be seen fairly urgently. And, we also want to make sure that people understand that, the weather, the temperatures, staying pretty cold, the ice isn't going away. So certainly be careful out there when you're out and about.
All right. What do you tell people about how to handle this? I mean, everybody, most people, I guess if you're elderly, it's probably a good idea to stay in if there's snowy, icy, wet conditions. But most of us have to be out there. So what would you tell an individual about how to deal with the ice or how to shovel snow properly? Let's start with you, Dr. Schessler.
I think having some good boots so you have good traction to try to limit your falling, and I think just take it safely and slowly. Get the shovel out, clear some area off so you have some working room. Make sure you have some salt. Lowe's is always sold out of salt when the snowstorm hits, so make sure you have that stuff ahead of time, and just having good form when you're shoveling snow and not taking too heavy of a load and trying to throw it over your head or anything like that.
Dr. Micucci, anything to add?
Yeah, I would just try to contact all the young people in your neighborhood and tell them to get out of the house and shovel some driveways.
Yeah, I did see something about that. Actually, I heard it on Fox News right when the winter started. There was a doctor on there that suggested that people born before 1977, you shouldn't shovel snow, whether it because of the fall risk or people are just out of shape. There's people that aren't good enough shape to do it, and I thought, you got to be kidding me. That's good advice, but who in the world's going to shovel my snow at 4:30 in the morning when I'm trying to get to work? It seemed unrealistic.
Absolutely, that's a tough rule to live by there.
Absolutely. Okay, I understand that at Mountain State Orthopedics and through the Mon Health system, you offer same-day joint replacement. That's at the Mon Health Outpatient Surgery Center. What are these type of procedures? That seems amazing. So let's start. I'll let each of you answer that question. Dr. Schessler, what type of services are provided that same-day joint replacement at Mon Health Outpatient Surgery Center?
So same-day joint replacement has been a great thing for our patients. This allows a person who is healthy and strong but needs a knee or a hip replacement because of bad, painful arthritis to be able to come in, have their surgery, but they're able to safely recover afterwards without having to be in the hospital for several days. There are lots of good techniques and medications we use to make sure that every person that has this procedure is comfortable and is able to take care of themselves once their surgery is finished. And so we evaluate every person in the office that needs a joint replacement, and we make sure that everyone has medical problems, but we make sure that those medical problems are safe to do an outpatient surgery for. So there's a very rigorous process.
Mm-hmm. Dr. Micucci, anything to add?
Yeah, no, I think he touched on all the highlights for sure. I would just say that, this was something that, took a few years to work to develop, and with Mon Health and our anesthesia group down at the Ambulatory Surgery Center, led by Dr. Guerra, has been just an amazing thing for patients, especially when some of the patients have had maybe a replacement, 5, 6, 7 years ago, and then at this point have the other side done and have it done in an outpatient setting, which includes, all the preoperative things that Dr. Schessler touched on, sitting down, having a meeting with the joint camp, with the whole team prior to your surgery, just the education that goes into it for the patient certainly has been really dramatic in regards to outcomes as well, and just patient preparation. So it's been a great thing teaming up with Mon Health to get that accomplished.
How new is this revelation?
About 2 years since we started actually performing the procedures on an outpatient basis.
And I'm sorry.
No, I was just saying it was a few years in the making prior to that, but it's been 2 years since we've been performing the procedures. Shoulders also on that list for some patients, actually. So knees, hips, and shoulder replacements.
All right, knees, hips, and shoulders, and I would imagine that a key to with any operation, I would imagine, especially if you're sent home that day, a key of recovering is the rehab process. That's that's pretty extensive, but it's still it's nice to be able to go home.
Yeah, no, and again, patients do love it, and there's nothing like being home in your own bed or, at least on your own couch. But again, part of that joint camp process is they actually meet with physical therapy. The home care is set up upon discharge. So say you come in, you have your knee replaced that morning. By the time you leave, say it's late morning, the physical therapists are meeting you at your house that afternoon. Wow. And so, again, just the everything that comes in, the multidisciplinary approach to getting this going and having it be so effective has been a great thing.
It is Mon Health Talk Radio for this Monday, January 24th. We appreciate you joining us, and we're with Dr. Chad Micucci, Dr. Matthew Schessler. They're with Mon Health Orthopedics as a part of Mountain State Orthopedics, and we'll continue the conversation. We'll talk about joint preservation and what goes into that, some tips, some things to do to maybe perhaps avoid some of the procedures we've talked about down the line. We'll continue the conversation on Mon Health Talk after this on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
It is Mont Health Talk for this Monday. Thanks for joining us on WAJR. We're visiting with two members from Mountain State Orthopedics, Dr. Chad Micucci, Dr. Matthew Schessler, and we're talking about orthopedic help. We talked about the same-day joint replacement procedures at the Mon Health Outpatient Surgery Center in our first segment. But, gentlemen, let's talk joint preservation now. What advice would you give to people who want to avoid these types of procedures, keep their joints healthy, keep their joints working into middle age and beyond? Dr. Schessler, let's start with you.
So I think that there's lots of ways we try to preserve joints and keep people from needing hip, knee, and shoulder replacements. First and foremost is if something is hurting, come get it looked at so we can figure out what's going on, and then some of the strategies that we have to try to just make the joint do better and make the joint move better to try to prevent it from going bad.
So there are some exercises there that if something feels like it's hurting or starting to fail, there's some exercises that you can do preliminarily?
Yeah, that is certainly one option. There are lots of different treatments out there, and that Dr. Micucci does a good number of them in the needs for joint preservation type techniques. But I think first and foremost, you got to come get it looked at so we can figure out what's going on and get a plan together.
All right, Dr. Micucci, over to you.
Yeah, I think we start with the approach of everyone's different, right? So we individualize it for the patient, and like Dr. Schessler just mentioned, what is the problem? So that's the first part. Second is what can the patient do, lifestyle management-wise, activity-wise, maybe backing off on activity. So there's multiple things that we would look at and say, hey, say your knee is starting to get a little arthritic. What do you do every day? What's your job duties entail? And how can we modify those, whether that be the patient doing it on their own, involving physical therapy, some type of bracing, and those things. Mm-hmm. And then when we get into, mostly when patients are coming to see us, it's a little more of a problem, right? It's affecting everyday activity. No one wants to be in pain. And so we start getting into what you're asking about, specifically joint preservation. And so that is more of again, medical term, orthopedic term to say, what can we do to prevent people from going down the path of needing a replacement? And so there are some injections that we do. We all know about cortisone injections, and I'm not talking about those specifically. There are some other injections we'll use that for long-term management of cartilage problems are better for the joint. And then in regards to surgical options, and that's really the big thing when we talk about joint preservation is in orthopedics is about what surgeries there are, because 15, 20 years ago, there weren't a lot of options. The biggest thing is, can we keep the cartilage that we were born with? And there's some better procedures to possibly do that. They're not perfect yet, and that's why we're still seeing a ton of joint replacements. But that's sort of the general summary of what joint preservation entails, and it's partly what can the patient do, and then what can we do in orthopedics to maybe keep you out of the operating room.
Right. As people get older, I know it's harder, but I guess one of the bottom lines through all of this is to keep moving the best you can, right? To keep those joints and keep those appendages healthy is to try to exercise, try to move them as much as you can that's comfortable, correct?
You're 100% right. The joints want to move. That's how you sort of get the fluid in the joint, and there's nutrition there in regards to joint mobility. And when joints stiffen up, they become painful, and sort of those type of processes like arthritis sort of get exacerbated, so to speak. And so, again, you have to modify and again, individualize it and say, yeah, we want to move, we want to minimize impact too, and how do we do that? What's the best treatment plan for you?
Mm-hmm. All right, so every situation's different. I know one of you referenced in the first segment, you talked about the joint camp. So what's that all about?
So, the joint camp, that's an effort that we do it at the Outpatient Surgery Center to help prepare people that are going to undergo an outpatient joint replacement. Typically, they meet once a week, and in that meeting, you have the anesthesiologist is present, a representative from physical therapy is present, a representative from the surgery center is present, just to explain how the day works, what you can expect from the time you get out of your car that you park 50 feet from the door and get to walk right into the place, to how we manage during the surgery with the anesthesiologist, and then even what to expect once you leave and get home, what you can expect from physical therapy, and that way you can help decide, is an outpatient joint replacement right for me? So there's a very extensive process that goes into making sure that everyone is well prepared to undergo the procedure.
All right, so that's the joint camp is specifically preparation for an upcoming orthopedic procedure.
Yes, it is.
Okay, very good. How can people reach out if they believe they're having a problem or they want to avoid a problem? What's your advice to reach out and learn more about their situation, or perhaps have a consultation?
Yeah, I think, in regards, and this ties into the joint camp as well, at monhealth.com/ortho, there is certainly, you can research the orthopedic surgeons and what we provide, the services at Mon Health and through Mountain State Orthopedics. Again, mountainstateorthopedic.com also will take you to our specific site. But within the Mon Health website, there's a link to go over the joint camp, what it entails, and there's also a video that you can watch. So, and that was initiated when the COVID pandemic hit, because we still were able to continue to do some of these outpatient procedures, because obviously you don't need a hospital bed for patients to be admitted, but we obviously didn't want to congregate to have a joint camp. So we were able to get that online so that patients that couldn't be here for that reason, or maybe they live 3 hours away, they're still getting that information. And that, again, like Dr. Schessler mentioned, it's important for the families as well, because, again, you need that support when you go home. So, and it's all about managing the medicines, and that's all, instructed before the surgery with handouts and almost like a schedule. And so, again, it really streamlines the process for patients and their families that are taking care of their loved ones.
Okay. Well, we got about a minute left, and obviously you guys now are dealing with, like we talked earlier, about the falls in the ice and the snow. Dr. Schessler dealing with the hand and the wrist injuries, and Dr. Micucci, you mentioned your specialty is in sports medicine. So I would imagine there's a lot of perhaps procedures and some rehab going on for athletes that have just come through football or whatever it is. You're dealing with those types of injuries as well in terms of the sports medicine practice.
Yeah, I think, the football season passed us now, and so we were right in the the heart of basketball season. So we have a lot of football players that are in the early part of their rehab if they needed something done due to an injury, unfortunately. And again, basketball injuries we see a good bit of ACL injuries with basketball as well. So unfortunately, again, we talk about educating patients and athletes what they can do to protect themselves and also maintain good strength and core stability that helps. But these are the nature of being athletic, and we're here to help when we can. We certainly don't want anyone to be injured, but if you're having a problem, call us, get in here, and we'll take a look and try to get you back to your athletics.
All right, very good. Dr. Chad Micucci, Dr. Matthew Schessler, they are with Mountain State Orthopedics. We've been talking in depth about joint preservation and the Outpatient Surgery Center with Mon Health. Great information, guys. We appreciate it. We'll talk to you again.
Thanks a lot.
Thank you.
All right. That is Mont Health Talk for this Monday on WAJR.